So to start with, packaging and labeling, what to look out for. So when you are buying a packet or a can or maybe a bottle of anything, the first thing to look out for is the tagline or the name of the product definitely which you are buying, whether it is corn or peas or atta or chawal. Next is please, after seeing the MRP, definitely see the nutritional labeling part, the nutritional facts panel, where you will be able to see actually how much uh, fat, how much protein, how much total sugar and added sugar are being put in that packet. The packet may claim that it's a no sugar one or a low sugar one or a low GI thing and all that. But definitely to get the approval from the FDA or FSSI, whatever board they are, going for, the nutritional panel, facts panel is a very important and authentic, supposedly authentic part. So check that, where you will be able to actually see whether they have done any kind of marketing gimmick or not. Next is the ingredient part. Definitely what all they have given in that part. If you are buying a instant mix, maybe a poha packet or a oats upma packet where you add water and it's all done. Often palm oil is added. Often certain preservatives are added. So check for them whether they are banned or not. Whether you will able to see, just you have your phone handy, right? When you go to a mall, so just check on that, because often in India still we find some banned colors and banned preservatives are used. So better to go for 0.01% added preservative items or the fresh ones. Next is very important, the expiry date part. Often you will see in the mall discounts are being given or some offers like buy one get two, buy one get one offers are given to those products where the expiry date is coming very near. So you may think, though, okay, I'll get buy one and I'll get two more. So you're buying that, but you are not seeing the expiry part. So after you are going back home, you're keeping it for another month, because obviously you cannot consume three packets all together. So this is the marketing gimmick that they do. There, from their part, it is all right, because when they are selling, it is not an expired product. But the expiry date, if it's very near, and they are selling it like this to clear their stock, you need to get yourself aware. Next is the allergen part and the additives or the preservative part. Suppose you are allergic to nuts or dairy, some kind of thing, or maybe gluten, as I was telling. So kindly read the labeling part where it is shown added nuts. Often it is written in red or green thing that it contains nuts or dairy. So that part you need to see. What are the red flag signs that you need to see before buying any product and definitely consuming that? Because ultimately it is going inside your body. You are using that, you are eating that. High sugar. Try to avoid all those HFCS like high fructose corn syrup, maltose, sucrose, all these types of things which are added as a preservative and also as a flavor enhancer. Say no to high salt, high trans fat, high saturated fat content items. So, how to read labels then? Check the serving size and the calorie part. If you are on a strict diet advice, or you know that yes, every day I consume almost 1500 calories, so you never know, one packet of a poha might give you 200 to 50 calories. So, always see the serving size and the calorie part before you are eating anything. Choose the nutrient part. Like if it says it is high on fiber, then check how much fiber it is giving, soluble or unsoluble or added fiber. What is it actually? Vitamins, low sugar, salt, saturated fat, these are the things you should watch out for. What coming to the ingredients part, the first few items, most of the product. So avoid any hidden sugars and trans fats. So this you can see if you check, if you read the nutritional fact panel, as I told you, then you will see total sugar is this gram, and under that there will be added sugar 20 grams. So you can see that the sugar have been added separately as a preservative, as a flavor enhancer, whatever be it. Certifications, definitely look for FSSI, UGMark, organic marks, and other marks. So, because nowadays many new products are being launched in the market. often we see that they are not being approved by any food board. So the certification matters a lot. If you want to try new product, if you are buying a, you know a product which has been already into the market for quite a long period of time, then really you do not have to see the certification. But definitely in this era of duplication, you need to be aware of the well known chain, of course. Last is the quick tip: lesser than 5% DV is low, greater than 20% DV is high. So if it is written, the mark is shown as low, then check out for low, lesser than 5%. And if it is high for 20% DV, then it's high. This is a quick tip that you can check on the labeling part. Uh, Next is just watch the video once, then I'll be telling. So the child is having carbonated beverage, now lollipop, a sugar-based candy. Screen time is quite high, and the distance between the phone and the eye. He's having pizza, processed food now, full of fat. Now having cotton candy, a sugar-based item again. Now having another processed high salt item, French fries, fried as well. Again having a lollipop, candy, high on sugar. Juice, which is less on fiber, high on sugar. Again a sweet item, fat item, ice cream. Now comes the twist. Having fruits, which is full of natural sugar and fiber. Having pomegranate, which is a natural source of sugar, fiber, mental, will take care of mental well-being. Green fruit, which has natural flavonoids, carotenoids, pumpkin, muskmelon, papaya, pineapple, yellow colored fruits. Having grapes, red colored fruits. Even these are sugar based but natural. So when the child is having such kind of items, the mental well-being, the physical well-being is taken care of. And you can see the internal well-being is also being taken care of. So what are the healthy eating habits that you want to inculcate in at your home, especially to the kids and toddlers? First thing, help them to choose their food wisely. Ask them, give them a plate full of fruits, vegetables, and many options, but healthy options. Then you ask your daughter, your son, or whoever is present to choose. So the choice is only made with healthy foods. He or she has no option to choose a junk food. So he or she will learn that I am given this food only. So these are healthy food. At school also, many schools have taken this initiative of inculcating healthy food and unhealthy food. In tiffins, they check whether the child is bringing a healthy food or an unhealthy food. I have seen myself, it is a case of 2.5 to 3 years old case, 3 year old child's case, where I have seen the girl is bringing a packet full of biscuit because she left her tiffin box in the school, and the school authority, like one parent shared that photo of the tiffin box in the group to tell that somebody has, misplaced her daughter's tiffin box. So she shared the photo in the group, and I saw that tiffin box is having 15, approximately, that a packet holds 15 pieces of biscuit. And mind you, the age is age of the child was 2.5 to 3 years old. So whoever has done it, be the mother, but the father or caregiver or the grandparent, whoever has, bothered to give the child this packet of biscuit in her tiffin, and that is all. The tiffin break was around 9:30 to 10. So practically it was the first thing that she was having. It is very difficult. It is very easy to become a father or a mother to a child. But in this era of infertility, it is very difficult to become a parent to a child. I believe this because, as I told you, in this era of infertility, you will become a mother or a father to a child. But if you have to be a parent, you have to look for the well being, not physically, like your child is doing well academically. No, you have to take care the well-being in terms of her health or his or her health also. So if you are giving something in their tiffin like chips or namkeen or chocolates or a packet of biscuits, what you are doing to your child will choose food accordingly, na? So give, teach your daughters, teach your sons that this is not the correct way of eating food. So eat at regular times. Definitely, you should have a pattern: breakfast during this time, lunch during this time, dinner during this time. There should be a discipline of eating pattern. Second is the portion control, how much you are giving. Too much you are giving to your force feeding your child. This is not good. You should know that frequent meal works for your child, or wholesome one at a time works for your child. Include all food groups that I've discussed, like carbohydrates, protein, fats, vitamins, minerals, water, fiber. All the groups daily. It's not like today I have given too much of protein. Okay, tomorrow I won't be giving too much of protein. Tomorrow I'll be giving too much of fat. It is not like that. It is not mathematics, or it is not what to say. You cannot balance it like that. Next is definitely limit, restrict, monitor processed or junk food. Stay hydrated and mindful eating, which means avoiding screen time while eating. Talk to the child while eating. Talk to the child about the food that he or she is having. Then she or he will have interest in the food she or she is having. Play with the child while sitting only. Talk to the child. What did you do in your school? But do not allow the child to see TV, television, or phone while eating. Let them enjoy the food. That's the main thing. Otherwise, your child will always run away from the food. Portion sizes, variety, and meal planning. It played a very important role. Often we see some parents are giving too much of food in a child's plate, because he or she is thinking that my child will eat all these things and he or she will become a very healthy individual. It's not like that. He or she might become obese. So you need to have small plates for portion control. Include multiple colors for varied nutrients, like I was telling you the in that video. The child was having green fruit, orange fruit, purple fruit, red fruit. So try to include multiple fruits. I'm not asking you to include green avocado or pink dragon fruit. All those are seasonal, local, yet colorful. Go for that only. Sample days menu. When we go to the restaurant, we ask for a menu card. Give us a menu card, I'll choose. Why don't we do it at home? I'm not putting you in a bad situation where you are going to ask your wife, give me the menu card, prepare today's dinner. But what you can do is you can do a cyclic menu that many hostel or mess do. So that you can beforehand do the preparation. Otherwise, you will think, today what should I prepare? Okay, let's order from restaurant. If you don't give yourself that prep time, then obviously you end up ordering outside. So do a cyclic menu. Monday breakfast is this, lunch is this, dinner is this. Tuesday, the three meals should be like this. Wednesday, three meals should be like this. Like that, you have a whole month menu like this only. You do not have to use your brain too much of stress into that. Tomorrow, what should I bring for the dinner? Tomorrow, what should I prepare for the lunch and all? But definitely, beforehand preparation matters a lot. Next is core principles and mindful eating. So eating on time is a very important thing. Today you are having your breakfast at 7 a.m., but tomorrow at 9 a.m. Of course, 7 a.m. can be 6:45, can be 7:15, 7:30, but 2 hours difference makes a huge lot of difference to your health, to your body as well, because your body is used to having breakfast at 7 or 7:30. For quite a long period of time, your body is not getting that fuel at the right time. So it will start, deteriorating. The functioning ability will go down. Always go for seasonal and local foods that I was telling in the previous slide. You do not have to buy the fancy ones to, be updated on the nutrition part. Yes, yes, I am a healthy individual. I am having a good nutrition because I am having avocado, dragon fruit, kiwi, and what all. No, you do not have to have all that. If you're staying abroad where these are very easily available, yes, obviously, you will not get guava easily there. You will not get many fruits which you get here. So what you get here, have that. What you get there, have there. Avoid distractions while eating. That is no screen time. Otherwise, whatever you are eating, you are not able to taste that. You are not able to differentiate. Okay, this is I'm having bhindi. Bhindi has seeds. It tastes like that. Tomorrow you are having parval curry. So what is the difference between bhindi and parval curry? That is how you start developing boredom towards food. All taste same, but your wife has prepared it, suppose, in a different way. But you are busy with the screen, so you are not being able to differentiate between a bhindi curry or a parval curry. So try to enjoy food while you are eating. Last is eat slow so that you can chew well, so that the digestion can go simultaneously, and stop when you are 70 to 80% full, not totally full. Because this is a technique we apply everywhere. Like even when we are filling a bucket full of water, what we do? Keeping 1/4 inches of our finger empty, we stop the tap, right? So that we can carry, so that the water doesn't fall off from the bucket. Same with our health only, na? Same with our body only. 80%, 70% should be full, 20-30% should be empty, so that they get enough. We don't feed ourselves. Next, coming to the most important part of this workshop, the medical issues part. Many of the people out India or outside India, in this whole universe, human beings, I'm telling, they suffer from a various lot of medical disorders. To start with, diabetes. What is diabetes? We all know diabetes and obesity, right? Diabetes is elevated blood sugar level. Obesity is weight gain abnormally. So if these two happen together, we refer to the term diabetes. So it is basically a combination of obesity and type 2 DM, which is caused by poor lifestyle choices and genetic also predisposition. So the causes are, if you are having too much of food, too much of calorie, then you are gaining weight, you are becoming overweight and eventually obese. You are also having a sedentary lifestyle. You are not doing any kind of physical activity, you are not hitting the gym and all that. So insulin resistance will get affected. And if you have a family history of diabetes also, then also likely you will have this diabetes. So all the symptoms will pile up and you will develop this issue diabetes. Symptoms can be jotted down as unexplained weight gain. You do not know how you are gaining weight, but actually you are gaining weight. Frequent urination is a common symptom of diabetes, along with increased thirst and hunger, fatigue and blurred vision, and also difficulty in losing weight despite diet attempts and now you start physically active and all that. Still, you are finding difficulty in losing weight. So here is a slide where the summary of all the factors linking to diabetes has been jotted down. Next, what you can do to it, what can be the nutritional and lifestyle approach? The diet tips can be such that choose whole grains over refined ones, like go for oats, millets, brown rice, jowar, bajra, ragi. Go for lean protein, skinless chicken. Avoid the skin part. Healthy fats. Choose, as I told you, fats are not bad, because in lipid profile report also you will see HDL, which is a good cholesterol. So healthy fats like the pufa mufa. Reduce your sugar intake, be it refined, be it in the form of sweets, whatever be it. Refined carbohydrates in the form of maida, corn starch, corn flour. and also the frozen food, processed food, preserved food, fried food. Uh, Increase your fiber part in your diet. From the lifestyle part, definitely 150 minutes per week, that is approximately 30 to 45 minutes per day. You should do any kind of brisk walk or any kind of physical activity. It can be yoga, it can be indoor exercise, non-instrumental, it can be HIIT, whatever form of. Weight loss of 5 to 10% improves insulin sensitivity. Once you start losing weight, you will see the improvement in your insulin sensitivity part. Monitor, we say SMBG, like self monitoring of blood glucose level. So you have to monitor your blood sugar level. If not regularly, then maybe bi-weekly using the glucometer. Avoid any kind of sugar beverages, fried foods, and excessive alcohol also. So I have seen this kind of patients coming to me and saying, I do not take sugar, not even in my tea, not even sweets and all. So if I'm not having sugar, if there is no sugar in my diet, then why have I developed this diabetes? No, nowhere it is written that if you consume sugar, then only you have this sugar related disease. Blood sugar and this refined sugar, these are not same, right? So how can it be that you are not taking refined sugar or any form of sugar and the blood sugar level will be not elevated? So watch out on that. Next is the hypertension part. Hypertension is what? When your blood pressure level goes up. How much? What the level is 120 by 80 plus minus 10. This is the normal level. So it can be 130 by 90 or it can be 110 by 60. This is also normal. That is why I say 120 by 80. So what are the causes of elevated blood pressure? If you take excess salt or raw salt in your diet, you might have a likely chance of, getting hypertension. If you are an obese person with high levels of work pressure, stress, anxiety, and your lifestyle is also very much sedentary, you do not do any kind of physical activity, and your your history is also, have your mother, your father have this HDN history, then likely you can have this disorder. The symptom is often silent, but it may include headaches, symptoms like headaches, gasping, that is shortness of breath, and dizziness. So the hypertension disorder can affect your whole body in the form of heart disease, cardiovascular disease, bone loss, loss of vision, which is extreme case, stroke, and also kidney disease. So these are the complications. What can be the nutritional or diet perspective to, curb down hypertension? You should follow a DASH diet. DASH diet is dietary approach to stop hypertension diet. So your diet should be high in fruits, vegetables, and whole grains. That is basically fiber. Low in fat, that is low fat dairy, lean meats, and reduce your sodium content to lesser than 1500 mg per day. In markets, there are low light salt, so you can go for that. Pink salt, you can have a combination of that. Lifestyle, coming to the lifestyle perspective, you should always maintain a healthy weight, healthy BMR. You should do regular physical activity of 35 to 40 minutes. You should limit your alcohol intake, quit smoking, and definitely well hydrated. The right diagram is showing the healthy zone of 180 by 80 diastolic and systolic pressure. Elevated zone would be greater than 120, lesser than 80. So like that, you can see stage 1, stage 2, hypertension, and ultimately hypertension crisis level. Next is the dyslipidemia part. What is this dyslipidemia? Means mal, which is not right. This word refers to that. And lipidemia is lipid. So if you have an impaired lipid profile, your cholesterol level, your triglyceride, HDL, LDL, VLDL, all these parameters are going up and down, then it is a case of sure dyslipidemia, where your high cholesterol or triglyceride, low HDL is going way above or below. So, what are the causes? Your diet probably is high in trans fat or saturated fat in the form of fried food you're consuming, maybe processed, maybe preserved food. You have a genetic history of having this kind of disorder. Diabetes is also one such cause for which you can develop this kind of disorder, where you can see this atherosclerosis is a condition where the fat layer gets deposited in the form of, you can see in this slide, the capillary tube. The cholesterol is getting accumulated, deposited in the blood vessels and blocking the normal blood circulation. Symptoms often asymptomatic, but definitely there can be causes of cases of chest pain, xanthomas, that is fat deposits under skin, atherosclerosis. So the complications can be stroke, heart attack, and so on. What can be the diet approach? You should increase on the omega-3 fatty acid part. You can take a capsule. You obviously, if you are not able to take fish and flaxseed due to your work schedule or whatever be the reason, but still I would ask you to take the fresh ones, like from the diet itself, fatty fish, or for the vegetarians, it is flax seeds. Eat soluble fiber in the form of oats, legumes to lower down your bad cholesterol. Avoid saturated fat, trans fat, processed, preserved, frozen, fried foods. And from the lifestyle perspective, do aerobic physical exercise, maintain your ideal weight, quit smoking and alcohol, and go for regular checkups. Like if you have an impaired lipid profile, the checkups should be done in an interval of 3 to 6 months. And if you're a healthy individual, you should do your lipid profile checked within a span of 6 to 12 months. Next is the fatty liver part. Now, people who have this weight gain issue, obesity issue, they are mostly predisposed to this condition where a, a thick layer of fat is being deposited, is covering the liver. So there are two types: alcoholic fatty liver disease and non-alcoholic. I'll be talking on the NAFLD part only, non-alcoholic part, where you're not consuming alcohol much, but still you have, gain weight, and you are detected with hepatomegaly, with fatty changes thing, which is another term for non-alcoholic fatty liver disease. So the causes is obesity. If you're consuming too much of fat, alcohol, sugar part, if your insulin resistance is not right, then so the symptoms can be, you are having fatigue, you're having some pain in the abdominal part, and if you are doing a ultrasonography, definitely you will be detected with this hepatomegaly with fatty changes grade 1 or 2 or 3. Complication is liver inflammation, cirrhosis, and liver cancer in extreme cases. So the diet tips would be to cut down your refined sugar and fructose part, eat whole grains, lean protein, unsaturated fats like PUFA and MUFA, increase on your antioxidant part, go for fresh, colored, flavonoids rich fruits and vegetables. From the lifestyle approach, go for regular exercise to improve the liver fat metabolism, maintain your healthy weight zone, and definitely avoid alcohol in such conditions. So, medical follow up would be go for regular liver function test, and also within a gap of 3 months, go for a whole abdomen USG ultrasonography. So these are the stages of liver damage, as you can see, from healthy liver, the fatty liver, fibrosis of liver, liver cirrhosis, and ultimately liver cancer. Next is the nutrition for gut spine axis. So we know what is gut. Probiotic, prebiotic is very good for gut immunity and all. But how does it link with the spine, spinal cord, spine axis, which links to the brain? Yes, it has got a direct positive connection. When your gut is fine, when your gut is good, then your brain is functioning well. This is the main connection. So, connection between the gut microbiome health and spinal or the brain function via immune and inflammatory pathways. So the causes of disruption can be, if you're having an imbalanced diet, poor diet that is low on fiber, low on antioxidant, low on omega-3 fatty acid, and definitely low on prebiotic, probiotic bacteria, then the fiber part is also getting compromised, and your body is inflamed somehow. You are having too much of stress in your lifestyle and a very low physically active lifestyle, then you may have this kind of issue. And the symptom can be various kind of digestive issue like bloating, acidity, gas, back pain, fatigue, and also brain fogginess. The diet tips can be like, include prebiotics and probiotics like kombucha, yogurt, kefir, and the prebiotic part, try to include fiber part like from the onions, garlic, bananas part. Go on anti-inflammatory foods to lower your body inflammation by including turmeric, ginger, green tea. And definitely, well, hydration is the main key. From the lifestyle part, maintain your spinal posture. Don't droop down when you are sitting or standing. Try to have a upright position, even if you are having work which involves sitting for quite a long time. Now, various pillows are also available on the market. Whatever is suiting you, try keep your spinal posture right. Utilize that. Regular stretching and core exercises would help you to manage this thing, and also try to lead a stress less less stress life with mindfulness and meditation, whatever suits you, as I say. What are the common disorders or mistakes in kids and toddlers' health? I think this is a very catchy thing for the mothers if they are listening, any mothers out there. So, the disorders you will find undernutrition to be the maximum, constipation, weight management, like it can be underweight or it can be overweight issue, and also some iron deficiency anemia. The mistakes are too much of outside food in the form of processed, preserved, fried, packaged items, skipping breakfast. My daughter or my son is like very much inclined to junk food. She often skips breakfast and wakes up and then hurries to the school. No, you have to develop a routine. You have to make your child understand. Maybe some soaked nuts with some milk, whatever is fine with him. Talk to him. Maybe a sattu water, whatever is going to fill for 2 3 hours before the actual tiffin break starts. Lack of fruits and vegetables and also whole grains in his or her diet. Too much of screen time and also less activity under the sun. The solution would be go for balanced meals, family meal time, so that screen time goes less, and limit sugar and salt. So, child nutrition common disorders to highlight iron deficiency, anemia, constipation, and obesity from junk food. Mistakes that parents make. Yes, they predispose the child. They expose the child to too many of packaged snacks. Okay, today is Friday. Let's go to the mall. Let's go for a movie. Okay, let's buy a packet of popcorn, let's buy a packet of nachos. Yes, definitely they also need this, but do not expose them too much of that. Yes, okay, once a month we'll be going out having some kind of food outside, but that is it. You are also allowing your daughter or son to have this kind of food, but limiting it to once a month or twice a month. Skipping breakfast. Oh, he or she is not ready to have breakfast and also saving time on me. Go to school without any breakfast. No, do not do that. Excess screen time and low activity under the sun. Often I get to hear from the parent that my child is a picky eater. 51% of the parents complain that. Normally, childs are picky eater. There is a phase that we say picky eater phase. That is when the child has turned 2 years. That phase we refer to a picky eater stage. That time, if you do not pay any attention, then your picky eater toddler will go up to a picky eater adolescent, and you can do not you won't be able to do anything to that. So try to make use of the time. Child doesn't like healthy food. 27% mothers complain that, because maybe you do not make that nutritious. You just give boiled vegetables to that toddler, so that is why he is not finding anything. So if you're making a pasta, try to make a home cooked pasta sauce, red sauce, by making use of tomatoes. So by this you can make a red sauce. So do not take help from outside to make any food tasty. You can do it home cooked way only. Cost of healthy food is 32%. No, no, absolutely not. If you buy the fancy one, yes, then it is going to make you drain. But if you are going for seasonal local food, then it won't cost you. It will the food cost will go down only. Lastly, no time to prepare healthy food. Many mothers, many parents, many caregivers complain. So it is because you do not plan. You get up and then you start thinking, what should I give in the tiffin? What should I prepare for my husband's tiffin? Why you should do that? I told you you should make a cyclic menu, then it is saving your time or preparation time. So if you are waking up and then thinking, then yes, it is going to take a toll on your health also. So prepare beforehand. If you're making something like vegetable oats chilla, You parboil the vegetables before the night before. So the vegetables are already boiled, are already cooked. So you do not have to waste your time on cooking the vegetables. So you can do this small kind of preparation day before, night before only. Building healthy habits early. As I told you, if you cannot train your toddler at the age of 2, 3 years, you have to deal with a picky eater adolescent. So try to involve kids in cooking, making meals fun with shapes and colors, and encourage outdoor play that is under the sun, as I was telling you. So the summary would be eat balanced meals in a family, not you are eating a balanced meal, but you are not giving your daughter or son a balanced meal. So as a family, try to eat balanced meal. Read food labels, avoid myths, follow signs, and be consistent in healthy habits. Okay, for 20 days I'm in a diet, I'm following healthy advice, healthy diet, and all. But the remaining 10 days, I am having alcohol, going to parties, and your daughter or son is seeing, your daughter or son is also seeing that. You are your daughter or son's idol, so you should not follow a path which is not healthy. So, to end the slide, to end this workshop, eating healthy is not just a diet, it is a lifestyle. So, I believe in this very much because, as I say, 20 days I'm following and the rest 10 days I'm not. So, that is not a lifestyle. You're just following a diet advice given by your nutritionist or dietitian or whoever it is. But if it is in your lifestyle, you should have followed that 365 days a year only. Thank you so much.